Really what inspired me to do these sessions was my family's own journey. You know, I've helped lots of clients, but it's totally different when it's your family that's making the journey. To help my son get Social Security disability benefits, which he started receiving earlier this year. And one of the first questions he asked when he started to get Social Security disability was, now what? Am I allowed to work? And so today I really designed this to answer that question. Now what? Are you allowed to work? And what are the rules and tools that are available to help you to go to work? If you have questions, please type them in the chat box. I want to be very clear that I'm not giving any legal advice today, and I really cannot listen to your personal stories and answer your personal questions about your situation. I will have, towards the end of the presentation, a resource slide, and one of the things included on that slide is actually a resource that I'll give you guys where you actually can get individualized information about how your work is going to impact your benefits, or your loved one's work is going to impact their benefits. So let's get started. So you've got Social Security disability benefits. Now what happens? So I want to go through and talk about this. So when you first start working on Social Security disability, the first phase, so there's really 3 phases. So phase 1 is a phase called the trial work period, or the TWP. Given you guys a lot of acronyms in here, but I've spelled them out. If you get confused about them and have questions, type those questions in the chat box. I'm more than happy to answer questions about all the acronyms. So the trial work period is when you first start working, and any month that you earn more than a threshold amount, and it's currently $940 a month for this year. It goes up a little bit each year. If you earn more than $940, you use 1 trial work period. And what Social Security does is they look at this month and they go back 60 months. So they look at a 5-year period going backward in time to see whether or not you've used 9 of these trial work period months. And once you've used your 9 trial work period months, your trial work period ends. During this phase, you can earn any amount of money. You could be making $1 million a month, and you're still going to get your Social Security disability insurance payment. Doesn't matter how much you make, you're going to get your check. So this is a really wonderful opportunity for people to really try to work and see and find a good fit for them. So when my son asked me that question, so now what, can I go to work? I said, absolutely, you can go to work. And I explained this to him, and he started working part-time. Because with his experience with his bipolar disorder, he can work really well part-time. He does so much better when he's working part-time. But every time he was trying to go up to full-time, it was too much and it would overwhelm him and he'd end up in the hospital. So this ability to work part-time and still get his Social Security disability benefit, he's realized he's making more money than he was when he worked full-time. So it's a pretty good deal. And so right now he's in his trial work period. So he started working the very end of January. But at that point, the end of January, he was only in training and he didn't start getting paid till February. So February was his first trial work period month. And he's been working continuously. So we know he's going to use February, March, April, May, June, July, August, and September would be his 8th trial work period month. But we know he's going to have surgery in September, and he's going to be out of work for at least a week. So we're not sure if he's actually going to make $940 a month. So let's say he doesn't work in September, then September doesn't count. October would be his 8th month, and November would be his 9th month. And then he would be done with his trial work period. So remember, it's only the months that you actually work and earn more than $940 that are going to count. So let's talk about phase 2. Phase 2 is called the Extended Period of Eligibility, or EPE. And this is a 36-month period, and the clock starts ticking as soon as you finish that 9th trial work period month. And unlike the trial work period where you had to work and earn a threshold amount to use it, once this clock starts ticking, it's ticking whether you're working or not. So I always tell people, make sure you wait and use that 9th trial work period when you're ready to continuously work and keep trying, if at all possible. So during the EPE, they're going to look on a month-by-month basis to see whether or not you get your check. And this determination is going to be made based on an earnings threshold amount. We're going to talk now about what that earnings threshold is called. So the earnings threshold amount they use is called substantial gainful activity, or SGA. The amount right now for most of the folks we're talking about is $1,310 gross per month. And that's really important. This is a monthly amount and it is gross income. So people always want to tell me what they net, what they get after taxes, but Social Security doesn't care about that. They want to know how much you're making before taxes. So during the EPE, if you earn less than this threshold amount, less than SGA, then you get your check. You still get your Social Security disability check. But if there's any month that you go over during your EPE, then you don't get your check, but for that month only. So they look every single month and it's like a switch. If you earn less than SGA, they turn on the switch and you get your Social Security disability check. And if you earn more than SGA, they turn the switch off and you don't get your Social Security disability check. And this happens over a 3-year period. One thing I want to let you know, though, is there's a little secret. I'll give you guys the secret. The first time you earn more than SGA in your EP is actually called a cessation month, where they would suspend you for the first time. You're actually going to get your benefits for that month and the next 2 months automatically. It's called a grace period. So they don't switch off right away. It takes them a few months to switch off the first time. What it means is if you were working, and let's say you were making $1,400 a month, you first started working, you would use your 9 trial work period months. And then because you were over SGA, the first month of your extended period of eligibility, they would try to switch off, but it wouldn't actually happen for a few months. So you would actually get a full 12 months worth of benefits before you would see your suspension of your Social Security disability payments. Got a caution on here about individuals who are getting childhood disability benefits. And we talked about this in June. These are individuals who are getting a Social Security disability insurance benefit, not off their own earnings record, but off the earnings record of a parent. And then in order to do that, that parent has to either be retired, disabled, or deceased, and has to have paid in enough credits to be eligible for a Social Security benefit for their child. If you're getting childhood disability benefits, you get all these same work incentives. But one caveat I want to give you guys is that if you show Social Security that you can earn more than SGA while getting childhood disability benefits, and something happens and your benefits stop and you have to reapply in the future, you're not going to be eligible because you would have performed SGA after the date of onset of your disability. So I want people to be careful about that. It's something I always caution families about. So Julia, I want to stop and see if there are any questions in the chat box. I'd be happy to answer those now. I can look and see. So the first question I got was, can they earn money from royalties? Yes, that counts as earned income. Absolutely. It's based on your work activity. All right. And the next response is just that I will get to the question, which I did. Are there any other questions while we're paused for a second?
Can you explain what you just said about you cautioned people to wait? I don't know exactly what you said.
Okay. So
people
who get a childhood disability benefit off a parent's earnings record are getting it because of the idea that they were dependent on their parents and they were never able to work and be self-supporting. And unfortunately, this odd amount, this SGA amount, $1,310 a month, is what Social Security considers to be enough to be self-supporting. I know it's a random number, but it's the number they use. And so you get the work incentive, so you'll keep getting your childhood disability benefits. But I've had clients who've worked and earned SGA and eventually worked their way off benefits. And we'll talk in a minute about how that happens. But they worked so much, and for so long, that they worked their way off their benefits completely. When they went back and reapplied to get back on their benefits, Social Security said, you're no longer dependent on your parents. You've been able to work and perform this earnings level, this SGA level, and therefore you're now only eligible on your earnings record. Now, if somebody's worked long enough that they worked their way off Social Security, it's quite possible they'll be eligible for a Social Security disability benefit on their own earnings record. but that may be less than they were eligible for on a childhood disability benefit. So for example, we know that for my son, the amount he's getting right now is about 2/3 of what he would get on my earnings record. So when I retire, or if I become disabled or I pass, he would get so much more money on my earnings record that that's something he's always thinking about. Like, will I be able to get benefits on my mom's record? Hope that answered Michelle.
Question. Yeah.
Yeah.
We have another question, Deborah.
Sure, Julia. Yeah.
It sounds like they can work as long as they want if they earn less than $940 a month or $1,310 a month. Is that correct?
Absolutely. If you earn less than $940 a month, you're never even using your child work period months, right? So you can do that indefinitely. And as long as you stay under this SGA amount, even if you use your child work period months, you're going to keep getting your Social Security disability benefits. But now I'm going to teach you some secret tricks. So hold on, we're getting to the good stuff. So I told you that SGA is $1,310, but that's not 100% true because there are certain deductions you can take from gross wages before Social Security looks at whether you're performing substantial gainful activity. And these are all deductions, they're expenses. They have to be related to the disability and they have to be needed in order to work. And they're called different things depending on who's paying for them. So the first one is called an IRWE, or an impairment-related work expense. I'm sorry, they love their acronyms. So an IRWE is a good or service that you pay for yourself out of your own pocket in order to be able to work. So I'm going to give you guys an example. My son could not ride a public bus. His anxiety is so overwhelming that being in that enclosed space with all those people and having no control would simply be overwhelming to him. He would not be able to function on a bus. We've tried it. It's extremely hard for him, especially a crowded bus at rush hour. So he drives himself to and from work. And so the mileage that he pays, and they use the IRS mileage rate that he uses to drive himself to and from work, could be deducted from his wages before they would consider whether or not he's performing SGA. Another common one that people often have with mental health conditions would be the cost of medication. If they have a copayment for their medication, a copayment for therapy, a copayment when they go see a psychiatrist, all of these costs could be considered impairment-related work expenses. And I always say get creative. I had a client years ago who had a mental health condition and she had a job and she was doing really well and they wanted to give her a raise. She was really worried about it. So we were talking about whether or not she had any IRWEs and she was saying, well, no, her medication costs were covered entirely. The only thing that she was paying for out of pocket was a wake-up service. I said, what? So her medication made her really groggy in the morning. It was really hard for her to wake up and get out of bed. So she actually discovered that she paid for a service where they called her. You guys may remember the Seinfeld episode where they had a service like this, but they'd call and they'd keep calling until she was up and out of bed. And we got a note from her doctor saying this was a side effect of the medication that she needed in order to be able to work, and that this was a medically necessary service to get her to work. And the cost of that service was used as an impairment-related work expense, or an IRWE. She could deduct it from her earnings. Okay, so the next category of expenses that can be deducted are things that the employer pays for. They're called subsidies, employment subsidies. So this may be things that you commonly think of, like special accommodations. So if you need a special computer software, or you need a modified work chair, or some modifications to your work environment, these are the types of things that the employer may be providing for you, maybe providing under the ADA as a reasonable accommodation, but it still has a value that the employer is paying for it. And so that can be used. So I'll give you guys an example of that. I had a client who had some limited mobility issues and was in a wheelchair. And when he got into work every morning, one of his coworkers would come over and would help him take off his coat and take his lunchbox and put it in the lunchroom for him and help him get set up in his workspace for the day, maybe 10 minutes. And then at lunchtime, that same coworker would go and get the person's lunch and help them get set up They had special silverware they had to use to feed themselves and things like that, and then would put everything away after. So maybe another 10 minutes midday for lunch break. And then at the end of the day, that same person would come in and help my client get their coat back on and make sure they had their lunchbox and everything packed up and ready to go before they left. And when I said to the employer, well, this is a subsidy, he said, well, no, we're just being nice. And I said, well, no, but it costs you something. You're paying for half an hour a day of this person's time. My client works 5 days a week. That's 2.5 hours of this person's time every week that you're paying for. And that has a value to the employer. And so the value of that was something that could be deducted. Another thing that may count as a subsidy is if they're in an employment setting where they have a reduced productivity requirement. So maybe they work in a warehouse and everybody else in the warehouse is expected to clear 70 packages in an hour. And because of a person's disability, maybe they're only expected to do 50 packages. Well, they're doing less work than people who are getting paid the same amount. They would take the value of that subsidy and they would deduct it before they would consider whether or not the person's doing SGA. The third category is what's called special conditions. And that's something that somebody else is paying for, not the employee, not the employer, but a third party. A lot of times this may be a vocational rehabilitation service provider who's providing something like maybe job coaching, which we'll talk about a little bit later, or some other type of employment services that they're providing to help the person in their job. Maybe they're paying for some sort of special durable medical equipment, computer software, assistive devices, things like that. But I'll give you guys a real example. So my son's working part-time. So I am still paying for his therapy visits. I pay the copay for his therapy for him. I pay the copays for his medication. I pay for him to be well. And so those are things that I'm paying for that he would never be able to work if those expenses, if he didn't go to therapy, if he didn't take his medication. So he can actually use the cost and deduct it from his wages, even though he's not paying it, I'm paying it. So that's something that can be deducted. It is absolutely possible for somebody to have an impairment-related work expense and a subsidy and special conditions or any combination. It's not like you have to pick one. So for my son, in his case, we know he has the impairment-related work expense of his transportation to and from work, that mileage that he has to drive. And we know that he has a special condition and that I am paying for the medical care that he needs to be well to work. So all of those things can be used to reduce wages to below SGA. So that gets subtracted from the gross income level before they look to see whether or not somebody is making $1,310. So I've had clients who are making $1,500 a month, $1,800 a month. But if they have significant costs like these, it's possible they're not actually earning SGA after these costs are deducted. So this is an individualized determination. And at the end, again, I'm going to give you a resource where you could actually contact somebody who will do this analysis for you and figure out with your work and your benefits exactly which of these work incentives would apply. Other two things I want to let you guys know about are some other tools that may mean that work isn't actually SGA. The first one is called wage averaging. We all know that some people get paid weekly and they may end up with 5 paychecks in a month, or they may work and get paid every 2 weeks and they might end up with 3 paychecks in a month, which may push them just over SGA, right? If they get that extra paycheck. What wage averaging says is we're going to look at a period up to 12 months where they've been doing the same job, same pay and all of that. And we're going to average the wages over that time period, because it's possible they're not actually earning SGA, they just had some months where they got an extra paycheck. So wage averaging is a great tool for those people who might get an extra paycheck. The other one I want to let you guys know about, because this actually comes up a lot with my clients I work with who have mental health diagnoses. It's called an unsuccessful work attempt. And what it says is that if you try working and either you're getting extra supports that eventually end. So maybe your employer says, for 3 months, we're going to help you, get you extra help with this. And then we expect you to know how to do it on your own. And we're going to take away the extra help. Or because their condition worsens, or maybe it's the stress related to work, maybe it's something physically demanding about work, but they're not able to maintain working and earning at the SGA level for more than 6 months, if they have to stop before 6 months, that can be considered an unsuccessful work attempt, and they won't count any of it as SGA level work. And so I do see this with people who maybe they get ambitious. My son, every time he tried to go to work full time, he'd go to work full time, he could maybe last a couple months, and then he would end up in the hospital and he would go back to part-time. So even though he would have earned over the SGA level in those months, they would be considered unsuccessful work attempt months because he was never able to sustain working and earning at that level for more than 6 months. And it was because of his disability. I'm going to pause now and give you guys a chance to ask questions because I know those are a lot of really complex concepts. So what questions do you guys have? Julie, I see there's one in the chat box. Could you let me know what it is?
No, I think that was Janice's last question.
Oh, okay.
Yeah.
Anybody else?
No questions right now.
Okay, then we're going to move on. So we talked about trial work period phase 1. We talked about the extended period of eligibility phase 2. And now we're going to talk about what happens after that extended period of eligibility. So after the 9-month trial work period, after the 36-month extended period of eligibility, after that, if you work and earn more than SGA, then your Social Security Disability Insurance, your SSDI, is going to actually be terminated. They're going to stop your benefit. You still get all those same work incentives I just talked about. You could still use IRWI, subsidies, special conditions, all of that's still available. But if you are actually earning more than SGA, even with all of those work tools, then at that point, your SSDI's check would stop. But there's a safety net. And that safety net is called the expedited reinstatement period. An expedited reinstatement says that after your benefit stops because of work, if you're unable to keep working and earning at that level, you have up to 60 months. If you have to stop working at any point within that 60-month period, you can reapply for expedited reinstatement. You're not back at square one applying for benefits, having to prove that you're disabled all over again. You can apply for this expedited reinstatement and they'll start benefits. And you can get up to 6 months of provisional benefits while they do what they call a medical improvement review. So they just look to make sure that you haven't medically improved, that you still have a medical condition that meets their definition of disability. And if you do, then you're right back onto benefits. And eventually, after some complex rules, you can earn a new trial work period and a new extended period of eligibility. And it's amazing. So you can start back over. This is an amazing tool, especially for a lot of my clients who have a mental health diagnosis, who maybe they do really well for a few years. They're doing great. They're able to work. Everything's going well. And then something happens and they're not able to sustain working at that level. They have to cut back. Maybe they have a hospitalization. Maybe their doctor just tells them to take a break. If any of that happens, there's this safety net. So this is an amazing tool that's available to people. And I find that these tools, in my experience, work really well for people with a mental health diagnosis. They are fantastic at helping people to keep that safety net of Social Security benefits. And in my experience, once a client's been able to work for more than 5 years at the SGA level, they're usually going to be able to sustain it for a while. This is a really long period of time, between the 9-month trial work period and the 36 months of the EP, and then you've got the 60-month window. That's over almost 9 years you get to try working before your benefits would be gone, that you would have to reapply. So these are fantastic safety nets, and I think they make a huge difference for folks. All right, let's talk about healthcare, because I know healthcare is key, right? Don't have healthcare. I couldn't work without my healthcare. I've got asthma. I've got to manage that. I think a lot of people have health conditions where healthcare is essential. So we talked last time about the fact that people on Social Security Disability Insurance are on Medicare after a 24-month waiting period. And with extended period of Medicare coverage, that says that even after your Social Security Disability Insurance payments would stop, because normally that's the key, you've got to be getting Social Security Disability Insurance to get Medicare. But even if that's stopped, you get an extended period of Medicare coverage for at least 93 months after the trial work period ends. That's 7 years and 9 months of Medicare coverage guaranteed. And if at any point you go back on Social Security disability, whether that's during the APE or whether you get expedited reinstatement later, you keep your Medicare and you get it right back on it. So this is a great safety net to make sure that somebody continues to have Medicare coverage. It's really an important safety net, and I just want to reassure people that you can keep Medicare. There are also several Medicaid options that are available, and I want to let you guys know about some of those Medicaid options. So my son right now has Medicaid, actually. He has a type of Medicaid called Magi Medicaid. It is what people think of as the Medicaid expansion. It's for adults who don't have a disability necessarily, they're just low income. And so he's been on Magi Medicaid for a while now, even before he started getting Social Security disability. He's also on my health insurance because he's under 26. So my insurance pays first, and then Medicaid pays second for any expenses. He still has some out-of-pocket costs because some of the things he does are not covered by Medicaid. So for example, his therapist isn't covered by Medicaid, so I cover that bill for him, as I mentioned previously. There's another program called Medicaid Buy-in for workers with disabilities. You'll commonly hear it referred to as MBIWD. And this is a Medicaid program, like it says, for people who have a disability and who are working. You do not have to be getting a Social Security benefit in order to get MBIWD. So there are people who might lose their Social Security disability, right? Because they worked and earned over SGA and they're still earning over SGA after their extended period of eligibility. Those folks will be eligible for this Medicaid buy-in program. A couple things to know about it. Depending on your income, you might have a small monthly premium that you pay for Medicaid buy-in for workers with disabilities. It's usually significantly less than what those of us who get it through our employers are used to paying for our health insurance premiums. It's a good deal. And the state of Ohio has not actually collected those premiums in about 4 years. And so I don't know what's up with that. They just stopped doing it. Some states stopped doing it and said they are going to not do it because the cost of collecting the premiums exceeded the value of money they collected. Ohio hasn't said that, but they haven't collected it in years. So even though there may be a premium, you don't have to pay it right now. The other thing about Medicaid buy-in for workers with disabilities is sometimes people have to stop working for a bit. Again, maybe they're in the hospital, maybe their doctor said take a break. My son's having surgery coming up, right? So there are times when people have to stop working for a bit. And during those times, Medicaid buy-in for workers with disabilities will continue to cover them as long as they intend to go back to work. So it can't be that your doctor said, this is it, you can never work again. It has to be something that's temporary, where there's been something medical that's happened and you intend to go back to work. So there's another category of Medicaid that I want to let you guys know about. It's called SRS Medicaid. And this is a Medicaid program that offers supplemental recovery services for people with specific medical conditions. But mental health is one of those conditions. And the amazing thing about SRS Medicaid is that the income threshold for this Medicaid category is so high. It is currently $2,382 a month in income, and you could be eligible for this Medicaid program. It comes with full Medicaid coverage. Plus, it covers things like peer support services, case management services, and other types of services that people in the mental health system frequently use. So this is a fantastic Medicaid program, and it's one that I think doesn't get used as often. And so sometimes the people at Job and Family Services, which is our state agency that administers Medicaid on the county level, sometimes they'll say, well, you're disabled, but your income's too high. You don't qualify for Medicaid because your income's too high. And I frequently will remind them, but what about SRS Medicaid? And they're like, oh yeah, no, they're eligible for SRS Medicaid. So it's just another great resource. And then there's a whole package of Medicaid programs have the strange name of Medicare Premium Assistance Programs. So for people, they're also called MPAPs for short, because, you know, we got to have an acronym, right? What they do is help pay your Medicare Part B premium, which is currently about $148 a month. So for low-income people, Medicaid will actually cover the Medicare premium, the Part B premium. It will also cover the Medicare cost sharing expenses. So one of them will cover everything out of pocket. So if you have this coverage, you don't have to pay your Medicare Part B premium, and you may get help with the other Medicare cost sharing expenses, things like deductibles, co-payments, and co-insurance. So I'm going to stop for a minute and see if there are any questions about Medicare or Medicaid before we move on. And I'll give you guys a second to type.
There aren't any questions yet. There's one question if we have time. I think it's a little more specific. Okay, there is a question now. Does the work income affect the cost sharing expenses?
So the Medicare cost sharing expenses are set. And so there's a set amount that's the deductible. There's the set amount that's your copay. So for example, with Part B, when you go to see the doctor, generally Medicare will pay 80% of that cost and you'll pay 20%. So those are set amounts. They're not dependent on your income, but they are dependent on the cost of care. So, you know, if I go to a doctor that's $100, then I'm going to pay $20. But if I go to a doctor that's $200, I'm going to pay $40. So it's really dependent on the cost of the Medicare covered service. I see we have a couple more, Julia.
Right. She clarified this a little bit. Does the work income affect the cost sharing expenses provided by Medicare by Medicaid to Medicare by Medicaid?
So when you're looking at eligibility for these Medicare premium assistance programs, it is based on income, and they do include earned income. But, and this is harkening back to last month, but they follow SSI income counting rules. So even though your earned income is going to count, they're going to count less than half of it. A lot of it will be deducted. And if you want to come to the August training, I'll tell you all about all those deductions.
Okay, there are no other questions. Any other questions on what Deborah's covered until now?
Just saw another one pop up in the chat box. I can't see it, but I saw the number go up.
Okay, she said thanks.
Okay. All right, well, I'll get through this and then we'll stop and actually let you guys unmute yourselves and ask questions. So I'm going to continue right now. So there's also help out there for preparing for work, finding and keeping a job. And people don't realize there are free services out there that will help you with these sorts of things. So one is a state agency. It's called OOD, or Opportunities for Ohioans with Disabilities. It used to be called BVR, or the Bureau of Vocational Rehabilitation. Actually, one part of it is still called BVR. But BVR or OOD can help with a bunch of vocational things. They can help pay for job training. Maybe you need a certification of some sort to be able to do a job. Maybe you need assistive technology, some durable medical equipment. Maybe you need vehicle modifications. There are all kinds of things they can help with to support you in working. And they're provided absolutely free for folks who are eligible. So this is a great resource. If people are thinking, I could go to work, but I need help with this. My son has actually applied for help with them and is talking about going to school and getting some more education, which would give him more employment options and would increase his employability. And so he's talking about working with them to do that. There are also employment networks. These are organizations that Social Security actually pays to help you find a job. And they are paid through a system called Ticket to Work, which we'll talk about a little bit in a minute. But these employment networks can help with a wide range of services. And there are two that provide help for people with mental health diagnoses here in our area in Southwest Ohio. So one is called ICRON. They are located in Mount Auburn. And then Easter Seals, which has some different locations. And they offer a variety of services, but I'll give you guys a specific example. When my son was looking to first go to work when he was a teenager, he kept interviewing for jobs and coming home and he never got calls. And I was like, what is going on? So I said, hey, kid, what's happening to these job interviews that you don't even get a call or anything? And he said, oh, well, I have a panic attack and I leave. And I was like, oh yeah, you're not going to get a job if you have a panic attack and leave every time you interview for a job. So he went to ICRON. They actually had a special program for teenagers and young adults. They worked with them for a couple of weeks on just practicing interviewing skills, and did it over and over and over and gave him tips for how to manage his anxiety in that setting until he felt very comfortable. And the next job he went out and interviewed for, he got. So they were really helpful. And then the other thing they did was they provided him with a job coach. Now, it was his decision that he did not want his job coach on site with him at work because he didn't want people to know that he had a disability. So the job coach actually would just call and check in with him on a weekly basis and see how things were going and help him problem solve. But he could also call her. So there was one day that something happened with a coworker, and he talked to a supervisor about it, and the supervisor was not very helpful. And Jordan was feeling really frustrated, and he was like ready to just walk out and just leave the job. And he was just so frustrated and overwhelmed by what had happened. So he called his job coach and she talked him through it. And they came up with a solution to the problem and a strategy to try. And he went back to work and talked to his supervisor again, using the tips that she had given, and they got the problem solved. So these are really important tools sometimes for people to be able to be successful in work. So I just wanted you guys to know that they're available. Another agency that does do job services here in the greater Cincinnati area is Greater Cincinnati Behavioral Health. So that's just another option. Wanted to give you guys some tools and an idea of kind of how they could help. So the Ticket to Work is a program that comes out of the 1999 law, the Ticket to Work and Work Incentives Improvement Act of 1999. I will not give you the acronym, but this created a couple of different tools. One is the employment networks I mentioned, which Social Security pays for. The other is a program called Work Incentives Planning and Assistance. And this is the program that if you have questions about how is my work going to impact my benefits, you can call and they'll connect you with somebody who will do an individualized analysis. They will verify all of your benefits, not just the ones we've talked about today, but they will also verify things like subsidized housing, SNAP or food stamps benefits. If you have children who have benefits, they'll verify everything. And then they'll give you an individualized plan of how your work is going to impact your benefits. And they'll talk specifically about the job offer you have or the job that you have, or if you've been offered a raise or a promotion, they'll work with you along the way to help you use all these tools. They can help you submit information that's needed to establish IRWs. They can help you learn how to report your wages. There's just a lot of services they can offer. So if you're sitting here going, ooh, I've got questions about what's going on with my own loved one or with my benefits, WIPA might be a great tool for you. So I want to talk for a minute about reporting wages because it's extremely important. You should report under Social Security's rules by the 10th of each month. So if I worked in June, then by July 10th, I should have reported those wages. And if I'm working this month, then by August 10th, I should report my July wages. You can do this by calling your local office. You can mail copies of your pay stubs to your local office, or you can visit your local office in person, but not right now. Social Security local offices are currently closed still due to the pandemic. You cannot walk in. Had a client call me the other day, really upset because he said when he got there, they had locked the door and would not let him in. And I had to explain that it was not him personally, that the offices are closed to the public right now. They'll do appointments for very limited things, but wage reporting is not something they're going to give you an appointment for. The important thing is to keep a record of how you reported. So I think the best way to do it is through your My Social Security account. So if you call Social Security right now and say, I'm working, and give them the information off your pay stub, they will actually add that employer to your My Social Security account. So the next time you log in, there's going to be a tab that says wage reporting. And if you click on that, there'll be a drop-down menu and you can pick your employer from that drop-down menu. And then you can just report your wages on a monthly basis through this website. And if you've got internet access and a device that'll let you do it, it's so quick and easy. And you have proof that you did it. So that if later on they say, well, you never reported that you were working, you've got proof that you did it. It's really important to keep this record. So make sure that, I tell people, just get a file folder, put on one side, all of your wage reports, and on the other side, put any notices you get from Social Security. But I'm going to warn you guys about something that's really common. So when my son called and reported to them that he was working in March, because remember, he got his first paychecks in February, he called them before March 10th and he said, hey, I'm working. And they said, don't call us back for 9 months. And normally if somebody told you that, that wouldn't make much sense. But now your brain's going 9 months, 9 months. Why 9 months? Trial work period. So he called me right away and they said not to call back for 9 months. And I said, oh, that's the trial work period, remember? And he's like, oh, it's because I can earn any amount and I'm still going to get my check. And I said, yes. I said, after 9 months, they're going to want to check in with you and see how much you're earning. And you'll need to start reporting then. Because remember, during the EPE, they make a month-by-month determination about whether or not you get your check, right? So it's very common for them to say, don't worry about it for the first 9 months that you're working. Don't panic. I would still report. I told my son to still report. I know my son is not reporting currently, but I just think it's good to get in the habit of reporting early, because if you don't, then it's hard to remember down the road. But at any rate, that's wage reporting. I want to pause again and see if there are any questions about wage reporting, employment network, WIPA services, any of that stuff.
No questions, Deborah. Yeah.
Okay, great.
I think you're covering it all.
Good. Glad to hear it.
Okay, there's something right now.
Okay.
Is this for all jobs total? And then yes. There's another one after that, but let's take the first one. Is this for all jobs total?
So whatever, if you're working multiple jobs in 1 month, yes, it would be, they would add up the wages from all of those jobs. So let's say that you were working part-time at Kroger, and then you got a side hustle and you were driving for DoorDash on the days you were off at Kroger. They would combine those wages when they would look at whether or not you were performing SGA or using a trial work period month.
Okay. And another one, is there a minimum to report?
There's not. Technically, the law says you should report any earned income.
Okay, and one more, if you keep losing your job, I guess it's followed from the previous question from Janet. Is this for all jobs total? If you keep losing your job, I guess, what do you do?
So remember, only those months that you work and earn more than the $940 are going to count as trial work period months. And then during the EPE, you're going to get your check every month that you're not performing SGA. Remember, there are the rules about when we're looking at SGA unsuccessful work attempts, and that happens a lot for people who keep losing their jobs. So maybe they work for a few months and then they lose their job. I had clients who worked for a day or a week and lost their job. Those would be unsuccessful work attempts. And so they wouldn't even be counting that towards SGA level work. So there are safety nets built in, recognizing that sometimes it's going to take people trial and error to find the right job. But if you work multiple jobs in 1 month, let's say I work a job for a couple of days and it doesn't work out, and then 2 weeks later I start a different job, they're going to add all the wages I get this month, no matter which employer they're from. They're going to add all of it together to see whether I used a trial work period month, or after that to see whether or not I performed SGA.
Okay. That's it for now.
Okay, great. Thank you, Julia. So I wanted to give you guys some resources. Now, these are the same resources on every presentation I'm doing, so I'm going to highlight the ones that are important for this presentation. The first is the Ticket to Work information and referrals. And I've given you guys a website here. It's called choosework.ssa.gov. This is the website you can go to look for employment networks in your area, to look at WIPA services in your area. And you can actually call, they have on there the number for the Ticket to Work helpline. They can help answer questions. They can actually make referrals for you. Just a lot of useful information at this website. The other thing I've given you guys is the Red Book. And the Red Book is the holy book of Social Security work rules. So all the work rules I've talked about today, they're all in this book, and it's written for non-attorneys. It's written for anybody to be able to read it and understand it. So if you have questions and you want to know more, you can order this online, or you can actually look at an online version. And I've given you guys a link to actually go to Social Security's website and look at the Red Book. And it gives great examples and explains everything really clearly. So those are the best ones for folks who have questions from today's presentation. So I have gone through everything that we needed to talk about. And at this point, if you have questions, you can feel free to unmute yourself and ask any questions that you have. Again, remember, I'm not going to be answering questions about your situation specifically, because if you want to know about your benefits specifically, you should be reaching out to the WIPA agency and getting that individualized information. But if you don't understand any of these concepts or my acronyms or anything like that, I'd be happy to answer those questions now. You can still put them in the chat box if you want, but if you'd like to turn your camera on and unmute yourselves, I'm happy to answer questions that way too. So I'm going to stop sharing my screen so we can actually see each other if you have questions you'd like to ask.
There are no questions in the chat box.
Okay. All right, well, you're welcome to type them in the chat box. And you're also welcome to unmute yourselves and ask any questions that you have.
Could you
show the previous screen? And by the previous screen, I think you mean the one with the resources. So I'm gonna actually go and do that. Hold on. I think you guys should also be getting a copy of these slides, correct, Julia?
Mm-hmm.
So if you missed anything, you guys will get all of these slides, so you will have them for your reference. Any other questions or requests?
I do have a question. I'm like very overwhelmed. My son.
I know, it's a lot.
I think I attended your first session. My son is 23. I don't know where to begin. Like, he used to work and he worked at Kroger and they're pretty good. He's on a short-term disability. I don't know what I should do first. He is with an agency. I guess I should start by applying for SSDI.
Yep. You can actually ask NAMI for the materials from the first training. It has instructions on how you can apply. It's actually really easy. If you go to the website ssa.gov, click on the button that says apply, you can actually do the application there, and loved ones can help with that application process to get that started. After the application is submitted, they will contact him about setting up a time to do an interview and get some more information. And then from there, they'll walk you through the process. But those slides may help. One thing I want to warn you is that almost everybody is denied initially. My son was denied, and I do this for a living, but he still was denied initially. So most people have to appeal. And that's the point where my son won his case, was when he appealed. So,
okay. Okay. So it's applying actually for SSDI.
Well, you know, again, there are two different benefits, and you apply for, I apply for everything up front. That's what my son did. He didn't know if he had enough work credits to get Social Security disability, or if he would just get SSI. The rules for younger people are much more generous. You can get Social Security disability more easily. You don't need as much work history because you don't have as much time to have had a work history, right? We can't say to a
Okay.
22-year-old or 23-year-old, you have to have worked for 10 years. That doesn't work. So
Okay.
you apply for both, and then they will let you know which he's eligible for. Okay.
So it's probably, okay, most likely I should do that. Start there first.
Yep. Yep.
Okay. All right. Thanks so much. It's been very helpful.
You're welcome. Any other questions?
While we are waiting for questions, I want to encourage everyone to take the evaluation, please. It helps us improve our programs. Deborah can incorporate some of that into her last presentation next month, which is August the 22nd. And it definitely helps us as a nonprofit when we report, when we write our reports, and it enables us to continue providing these services and more in the future. So please do take a minute. It's a very short evaluation. Please do take a minute to do that.
And just so you guys know, and I mentioned this at the beginning, but if you're on SSI, or some people are on both, I recognize that. If you're on SSI, the work rules are totally different. And that's why we have a completely different session, because I don't want to confuse or overwhelm anybody. But on August 22nd, we will talk specifically about what happens to SSI and the Medicaid that comes with SSI when people go to work. All right.
Janice, you had a quick question, right? Maybe Deborah can try to answer it in a minute or two. I mean, I know it was specific. Do you want to say it out loud? Because I cannot go back to your earlier chat for some reason.
Here I am. Yeah, I'm not sure what the only question that I had was for Deborah was if she had time to just go over briefly the different, how do you tell if they're on SSI or SSDI? My son got this without my involvement at all, and I just became the pay maybe 2 or 3 years ago, and I have no idea what exactly he's on. I'd like to encourage him to take advantage of any income that he can. And he's afraid it'll affect his benefits because it's all tied together. And
absolutely. I think fear of losing benefits is one of the greatest barriers for people about going to work, because it can take years to get on and a lot of work. And so the thought of losing all of that, losing your health care, I mean, that's scary stuff. So understanding these work rules is really important. So Social Security disability insurance is for people who've worked and paid in enough credits. And again, it depends on your age, how many credits you have to have. And the amount's going to vary. It's based off of how much you paid into the system. SSI is a needs-based program. It's for low-income people. The most you can get is $794 a month. That's the absolute most an individual could get. And there's resource limits. If you have more than $2,000 in countable resources, you're not going to get SSI. And so it's really a very low income program, but it has some amazing work rules. I always tell people on SSI, you're always better off working. Social Security disability, you're usually going to be better off working, but SSI, you're always going to be better off working no matter what. So if you have questions, certainly he can log into his My Social Security account and it will tell him which benefit he's on.
He can't do any of that. He's completely, you described it so well in the last workshop. It was between screaming and anger and crying, anything that stresses. So
Yeah.
hard to say. Anyway, yeah, I just wanted to try to figure out what he was on.
Did you say you're his representative payee?
Yes.
Okay, you're going to get notices then from Social Security periodically. And at the top of those notices, it's either going to say retirement, survivors, and disabled, or it's going to say supplemental security income. So if it's a supplemental security income, that's the program he's on. If it says retirement, survivors, or disability, then they're on Social Security disability.
Thank you. Thank
You're
you.
welcome. Yep. You also have the right as a represented payee to call Social Security anytime and ask them questions like that to verify that information.
Okay. Thanks, Deborah. I appreciate
You're
it.
welcome.
Yeah.
And the nice thing about, if somebody's interested in with the services, the very first thing they do is actually contact all the agencies and verify all the benefits for you to figure out exactly what you're on, exactly what your benefits amounts are, so that when they do the analysis of the work, they're giving you very individually tailored information that's based on accurate benefits information.
Okay. And that's Social Security to call them.
Actually, if you go to that Choose Work site on the resources page, that's how you get connected that way, through Choose Work.
Okay. Thank you.
You're
Okay,
welcome.
and with that question, we are exactly at 4 o'clock. Thank you, everyone, for being here this afternoon. Thank you, Deborah. You are amazing, and you have the best resources about a lot of things. So we really appreciate your time and all the time you spend preparing for all these presentations. We hope to see you all next month on the 22nd of August at 3 o'clock. And have a good rest of the day. Thanks, Deborah.
Thank you, Deborah.
Thank you.
Thank you. That was very good. Yeah, thank you.
All right. Well, thank you guys, and I'll see you next. Well, I'll see you Wednesday. What am I saying? I'll see you next month. I'll see you Wednesday.
Okay.
All right. Take
Thanks.
care. Bye-bye.
Take care. Bye.